My name is Dr. Mirko Glitscher, and I'm a research associate in the Paul-Ehrlich-Institute's virology research group, which is headed by Professor Eberhard Hild. One of the focal points of my research in the last few years has been the hepatitis E virus. This is a virus that causes liver inflammation. There are no authorized vaccines in the EU, and despite its frequent occurrence also in Germany, the hepatitis E virus is under-researched. As a result, we hardly have any treatment methods that are sustainably effective or well tolerated. Having suitable treatment methods would have a particular impact for individuals with weakened immune systems in the global north and for pregnant women in the global south, as they are in two of the risk groups. In order to develop active ingredients for treatment and to improve test systems, we at the Paul-Ehrlich-Institut are working on elucidating basic mechanisms of hepatitis E virus replication and virus particle release. In our latest study, we looked at the localization of the viral protein responsible for replicating the viral genome within an infected cell. This protein is also known as viral replicase, or P1. We found that this protein is localized in the endosomal system. This is a kind of network within the cell that contains multivesicular bodies called MVBs. We found the replicase within these MVBs. More specifically, we found that this localization depends on the protease that is part of the replicase. It is especially interesting to note here that MVBs are also responsible for the release of virus particles. These particles are essential for packaging and passing on viral genomes. The viral particles first enter the interior of the MVBs and are then released from the cell in vesicles known as exosomes. And this is exactly the process we observed for the viral replicase, even though it is not actually found in virus particles. This finding now allows us to develop targeted therapies that inhibit these two processes, genome multiplication and particle release, at the same time. Using adapted HEV models, we were also able to demonstrate that even without the presence of virus particles, the viral genome is still released in exosomes. This means that the classical virus particle is not necessarily required for the distribution of viral genomes. This also means that we have identified a new mechanism of release that can also support the initiation of an infection. These findings are also potentially important for diagnostics and product safety, because the detection of viral genomes does not always mean that viral particles are present. We now want to investigate whether this fact is really relevant in this context.